Welcome everyone, this is Kevin R. Miller, President of Vision Bound International, and I am reaching out to leaders in our nation's tribal healthcare teams to present ideas about one of the most important things for the future of Native American healthcare, that is developing outstanding leadership. In this project, I am actually partnering with Vida Co., who is President of Native American Healthcare Solutions, a Native American-owned consulting company. Vida has had over 30 years of experience leading Native healthcare teams. I have been teaching leadership and other subjects as well as consulting for almost 30 years, since retiring as a United States Army officer. Even as an officer, I taught leadership at the Command and General Staff College at Fort Leavenworth and in other situations, and continue to work with government, military, healthcare, and business teams internationally. Wherever I go, I see the best organizations are those who are well led. And perhaps that is why Stephen R. Covey said, quote, "Most organizations are overmanaged and underled." This is equally true in any of your healthcare teams. It is very possible for clinical and other team leads to manage a team and senior managers to manage a department or division and never really lead it. And many healthcare managers never make the leap to becoming visionary, motivating leaders. I believe we can overcome that. I am sure you have seen that just because a nurse, doctor, or technician is great at their job does not mean they're ready to lead a team of other people. In a stroke of a pen, we can lose a top performer and gain a poor, unprepared team lead. And the need for leadership is becoming more important than ever, especially in the changing world of the pandemic. I am reminded of Bob Dylan's song, "The Times They Are A-Changin'," and some of these greatest changes are hitting your teams as we speak. We need to find new and innovative ways to bring leadership development to a changing healthcare world. And the good news is we can now do it virtually in a way I will explain shortly. We need leaders who are visionary, motivating, and empowering. As a young lieutenant, I heard the statement from a military leader that, quote, "Leadership is the greatest force multiplier on the battlefield." And indeed, we are in a real battlefield for the welfare and health of our nation. I have had the privilege of working many days among Native healthcare teams in New Mexico and Arizona, teaching leadership and customer loyalty. The need is there and the desire is there, and we need to find new and better ways to present leadership in a way that is easily accessible and also extremely powerful and filled with tools that they can use immediately to create a greater culture in any team. Here are a few pictures of the teams I have worked with. One of my most enjoyable experiences was creating a strategic plan to open the new Kayenta Indian Health Services Health Center in Arizona. One of the programs I offer is My Customers Only Want Two Things, which is based upon my book. It has a chapter on service in healthcare, and I'd be happy to send you a copy or tell you more about the workshop. We believe that there are 3 lanes through which we can transform a culture, as shown on this diagram. Lane 1 is to win loyal customers through great service experiences. This is essential in healthcare. When patients, family, and community members are loyal to us, they don't hesitate to come in for vital services, speak well of us in the community, and are more likely to follow their healthcare regimen. The second lane is to instill inspiring leadership at all levels, from the most senior to even our emerging leaders. And finally, we need to build winning teams that are cohesive and high-performing. You will notice that I put leadership in the center lane because it pulls the others along with it. We need to make sure that leadership is competency-based. And here is a list of competencies that are important for all leaders, with a list of senior-level leadership competencies at the end. Our program will develop many of these important competencies. To this point, I have been teaching most of our programs in live sessions throughout the world, in the United States, Asia, and Europe. But with the advent of a changing world, I propose that we create the Native Healthcare Virtual Leadership Institute. This institute would consist of 12 one-hour sessions, taught virtually to groups of 10 to 30 in a Microsoft Teams environment, where participants from any location can interact, network, share best practices, and report on their weekly progress. These sessions can be done at any time during the day, even a lunch and learn format. And if someone misses a session, they'll be able to view it recorded later on. This allows for maximum flexibility as well as the best cost for your team, and you can complement all the other good things you're doing with leadership development. The model will be based upon my new book, which will be called Leaders Do 5 Things, Taking the Helm in a Turbulent World. As shown in this diagram, we need inspiring leaders to take the helm of the organization during turbulent times, not micromanaging or abandoning, but still keeping a steady hand on the wheel. The wheel has 5 spokes: envision, enroll, enable, engage, and explore. One of the most important things leaders do is create a clear vision and strategic plan. But this is not enough if they do not enroll people, physically, mentally, emotionally, and spiritually, so that everyone of all ages is excited about the important mission. But it's not enough to enroll people without enabling them with the training and resources they need to be successful. That would only frustrate them. Only then can you move to the next level to fully engage them with their passion and their talents. Finally, everyone in the organization needs to be involved in exploring new and better ways to give patient service and improve the organization. Senior leaders especially need to know how to navigate and lead change in this turbulent time ahead. Here you see the outline for one way the content can be organized into the 12 sessions, with 2 sessions aligned with each of the areas of the wheel. Of course, the program is modularized and can be adjusted and customized any way that the organization needs. There will be assignments and applications at the end of each hour block so that people can return and report what they did the week previously to apply their knowledge. People can also partner with an accountability partner throughout the 12 weeks. There are ways for this program to provide professional development credits, and we provide certificates of completion. These 12-session programs can be offered to both current managers and also to help prepare upcoming managers as our emerging leaders. Each program can begin with a recorded welcome and inspiring message from senior leaders. Vida has had decades of experience in native healthcare and can add her expertise on how to organize a healthcare team, work with boards, and provide greater clinical care. As far as materials, each person will receive a binder that has all the content sectioned behind 12 tabs. I also recommend that everyone receive a copy of the outstanding book, The Leadership Challenge. It is the best book on leadership that I know of. And most importantly, perhaps, they will each get a deck of my leader tip cards. Each of the 38 cards has one idea or tip on how to be an inspiring leader that day or week, and people choose the 5 actions they want to start with and record progress on this card. By doing things 21 times, it becomes a habit. These cards have been very successful in transforming leaders. So in this video, I wanted to share the vision and general idea for this Virtual Leadership Institute, and I welcome joining in a video conference call so that you can meet Vida and me and learn more about the program. We stand by to begin this great program as soon as possible. I promise this program will be inspiring and impactful and can help your native healthcare team into an ever brighter future. I close with a great quote by Peter Drucker, who said, quote, "Only 3 things happen naturally in organizations: friction, confusion, and underperformance. Everything else requires leadership." Let's move forward and overcome any friction and confusion and underperformance by instilling outstanding leadership throughout your healthcare team. It will be an honor and a privilege for Vida and me to work with you in this great endeavor.